Hi, Kevin Seidenstricker with American Media, an affiliate of Mansion Entertainment Group. Today in the studios, we have Dr. Sayfo with Uncommon Orthodontics, and we're just chatting about all things dental. Good morning, Doc.
Good morning.
Welcome again.
Thank you.
Well, as you requested, and I admire your enthusiasm and your courage, we have questions that were given to us through Facebook and through some call-ins. So we'll just have a chat and talk about some questions that our listeners have.
Yeah, I cannot wait.
All right. So Crystal from Neosho asks, can I brush my teeth with peroxide and baking soda to whiten them?
Yeah, the quick answer is yes. But before I answer that question, I will talk about not to whiten your teeth or use a whitening toothpaste while you are in braces. The bracket will be covering part of the tooth, and you do not want to whiten around that. So when you take the bracket off, it's going to look like two different colors. Now, as of her question, yes, you can. Actually, when I have questions from people who are trying to be very natural and avoid using chemicals and toothpaste, I tell them the best combination that you can use is peroxide, salt, clove, and baking soda.
Wow.
This is the mixture that you will find in every single toothpaste, minus all the chemicals that they put there. Of course, the consistency is not pasty, doesn't have a flavor, doesn't have the smell, all these kind of nice things that they inject and they add to the toothpaste. But if you want to decor what is going to work on your teeth, you just need a mixture between salt, clove, and baking soda.
Okay, and would you advocate equal measures of each of those?
Oh, it doesn't matter.
Doesn't
It
matter?
absolutely doesn't matter.
Mixed to taste then.
You know, if you are very natural, you're used to kind of weird tastes or stuff that have no taste or bad taste. So it's really not going to affect you. I have a couple patients that tried them and they loved them.
Awesome. Great answer. Mary Loritz asks, how will my ortho treatment affect my oral hygiene routine, and are there any extra steps I'll need to take?
Absolutely. I love this question. Now, just visualize that you have more hardware glued to your teeth. So access to your teeth, it becomes more challenging. So you cannot just go brush for 2 minutes and expect that to be done. You have to be very, very cautious about where you're brushing. You have to brush around the bracket, between the brackets, under the wire. When you floss, it's even more challenging. You have to use a special floss, or if you want really to do it right, use a water pick, which is going to go with the pulsing water between your teeth and go in and clean them. That's how you have to adjust. The biggest adjustment is snacking. Because every single time you snack, the food will be accumulated and trapped around your brackets for a long time.
And I'm going to follow up with my own question on that, if I may. I see different devices out there, plastic toothpicks where you can string floss through that. Do you recommend using those as well?
You can, absolutely. Those are fine and healthy. We call them the thread. The only problem with those, they take a long time. And no matter how patient you are, at some point you're going to drop the ball. So you want something really easy, efficient, quick, works every single time. Water pick is magic.
Okay, water picks, got it. I think that's going to lead into a question we're going to have in a little bit. But I'm going to go with Ashley's question from Carl Junction. She asked, do you personally prefer Invisalign versus braces? And why do you have this preference?
I do not have a preference. I would say it's patient by patient. If you are compliant, if you can wear your aligners 24/7, if you are really strict to regimen and you can follow orders and do it for a long time, over months, then aligners will work just fine for you. If you want something that's just glued to your teeth and it does the job every single time, but you have good hygiene regimen, then braces are good for you. So it's patient by patient. And if you can adhere to the system, aligners every day of the week.
Okay. Meg MacBerry wrote in her question, I had a permanent retainer placed after my braces were removed as a teen. Is it possible to have that removed now, or will my teeth shift? I was told I need it for the rest of my life.
That is very accurate. The study showed that 30% of patients need retainers. When they need retainers, it's for the rest of their life. Now, who is one of those 30%? We don't know.
Yeah.
That's why we have to apply it to everyone. And I would do not recommend experimenting, meaning, oh, let's see if I'm one of these 30% and take it out and see, because your teeth will shift and then you'll end up going back to treatment. So the short answer, yes, you need it for the rest of your life. But if you don't like it, you can take it out and have something removable, meaning just a thin sheet of plastic that sits snug on your teeth that you wear at night every night.
Okay. And our last question that we have, Doc, is from Justin Albright asks, are implants a more effective option over dentures, or are there more maintenance concerns to think about?
I would say hygiene with implants is crucial because it's a foreign body that's kind of like attached to your body that needs to be very, very, very clean, and you cannot afford to have plaque or bacteria harboring around that implant. Beside that, implants are amazing. It's 95% success rate. It is very, I would say, not very, more affordable than before. You're not really saving that much money, and it's fixed. It feels like natural teeth. It's there. You do not need to think about putting in, taking out, fitting, not fitting, rubbing you, falling, being stable. All these things are out. Even if you are thinking about a denture, let's say you have a lot of missing teeth and you think about denture, I will always recommend thinking about a denture that sits on top of an implant. Because it's fixed. It could be screwed in every 6 months to a year. You go to the dentist, they unscrew it, take it out, clean it for you, put it back in. But you take away any mobility, rubbing on your gum or inside of your mouth. It's very, very, very comfortable to eat with, and it's very aesthetic.
Are there any risks associated with implants?
The only risk is the failure, which is very, very low. Now we are talking about well-planned implant. The failure is 5%. It's lower than anything else, lower than actually a filling, but it's again, I put a couple lines under this, well-planned implant. Just don't go to anybody just to throw an implant on you because it's cheaper. Go to someone who's specialized. Go to someone who knows what he or she is doing. Plan it properly. Look at the bone. Look at the health of your gum. Put it right. You can put it once and you forget about it, and you're literally going to feel like you have your tooth back.
Cool. Anything else you want to wrap up with, Doc?
Just focus on your hygiene. We talk always about like how to replace teeth. I mean, the first advice, don't lose them if you can. So brush them every day. Avoid eating and drinking right before you go to bed. Avoid a lot of drinking soda and soft drinks and candy and stuff like this. Go to the dentist every 6 months. Probably you're bored listening to this, but really it is effective. And then last thing, one statistic. If you don't have pain, that doesn't mean you don't have a problem. That's why go to the dentist every 6 months. 75% of people losing their teeth lose them because of a gum disease, not because of cavities. Only 25% lose them because of cavities. And then gum disease is usually not painful. So you might lose your teeth without even any sign. Just all of a sudden your teeth are mobile. So brush and go visit your dentist every 6 months, and you should be fine.
Okay. Dr. Sayfo with Uncommon Orthodontics, thanks for being with us today.
Thank you.
Oh, and where can we find you?
We are in Uncommon Orthodontics. We are located in 2330 South Range Line, or you can find us on Facebook, Uncommon Ortho, or uncommonortho.com.
Awesome. Thanks again, Doc.
Thank you.
Dr. Sayfo with Uncommon Orthodontics. I'm Kevin Seidenstricker with American Media, an affiliate of Mansion Entertainment Group. Thanks, everybody, for writing in your questions today. Please follow us, continue to follow us on our website. And also, anytime you want to text us, you can text us at 417-623-6614. Thanks for watching.